The first 6 weeks after knee replacement are the most important phase of the entire recovery. The exercises you do in that window have a real effect on the motion you get back, and on the motion you might not. Recently, I made a video on 8 simple exercises for exactly this phase of recovery, and it's become the most watched video on my channel. Since then, some of you have asked for a shorter reference version, so that's exactly what this is. Demonstrations of the same 8 exercises, with the common mistakes to avoid for each one, and none of the extra fluff. If you want the full breakdown on the rationale behind each exercise and general guidelines on how much to do, that's all in the original video, which is linked in the description and at the end of this one. One important thing before we start: check with your medical team before trying these exercises yourself, because every patient and every recovery is different. Let's get straight to it. Prop your heel on a rolled towel or cushion, either while lying in bed or with your leg elevated on a chair, making sure nothing supports your knee. Let your knee hang freely in the air with gravity working to straighten it. You should feel a moderate stretch in the back of your knee. Work your way up to holding this position for 5 to 10 minutes at a time. Don't place a pillow or other support under your knee. This defeats the entire purpose by keeping it bent. The second mistake is stopping the stretch too soon. You need long periods of time to allow the tissue to stretch and remodel. Think of this like slowly stretching taffy rather than yanking on a rubber band. Lying flat with your surgical leg straight, contract your thigh muscle hard enough that you feel your knee press down into the bed. With practice, you should be able to feel your thigh firm up. Hold this maximum contraction for 5 to 10 seconds, then release completely. The full relaxation between reps is just as important as the contraction itself. Don't fake the muscle contraction. You should feel your knee straighten, and you may be able to see your quadriceps muscle get tense. If you're just thinking about tightening and not getting visible results, you may not be engaging the muscle properly. Try to avoid recruiting your hip or glutes to help. This should be isolated quad work. And remember, full relaxation between each contraction allows for a stronger contraction the next time. Start by mastering a solid quadriceps set with your leg flat. While you're performing this, maintain that contraction and lift your entire straight leg until your foot is about 12 inches or 30 centimeters off the surface. The knee must stay locked throughout. Hold the top position briefly, then control the descent. You can keep your non-surgical knee bent to protect your lower back from strain. The most common error is the knee involuntarily bending during the lift. We call this an extensor lag, and it means that your quadriceps isn't strong enough to do the exercise properly yet. If your knee starts bending during the lift, go back to quad sets and build more strength first. Don't compensate by hiking your hip or arching your back. The movement should be smooth and controlled from the thigh, not driven by momentum. Once you can stand comfortably, stand with your surgical knee slightly bent at about 30 degrees. Keeping your heel planted on the ground, straighten your knee fully, contracting your quadriceps hard. Hold this fully straightened position for a few seconds, feeling both the quadriceps contraction and a stretch behind your knee. Then slowly return to the starting position. This is a short arc movement focused entirely on that final straightening, so it's intentional that not much movement is going on here. As you progress, you can secure a resistance band in front of you and loop it around the back of your knee. This provides added resistance and strengthens your quadriceps even more. Don't lean your body forward or backward to help. The motion should come purely from your knee straightening. Keep your torso stable and isolate the movement to your knee joint. If you choose to add a resistance band for progression, make sure the band is positioned at knee height, not too high or too low. The resistance should be challenging, but not painful. If you can't keep your heel down or you're compensating with your whole body, the band may be too strong. Use lighter resistance or practice without the band first. While lying on your back, slide your heel toward your buttock, bringing your knee into as much flexion as you can reasonably tolerate. Hold the deepest bend for 5 to 10 seconds, then straighten your knee. At the end range of motion, you can loop a towel or strap around your foot to provide gentle overpressure, pulling just enough to feel a moderate stretch, not pain. Don't let your foot come off the floor. You aren't bending the knee so much as you are flexing the hip by doing this. It's also normal to have some discomfort with this exercise. Totally avoiding discomfort means you probably aren't stimulating enough progress, but you also don't want to overdo it. Repeatedly overinflaming the knee slows your progress as well. Find the line between discomfort and sharp pain and stay just below it. Sit on the edge of a bed or in a firm chair with your feet flat on the floor. Slowly slide your surgical foot backward under the chair or bed, bending your knee as far as you can reasonably tolerate. At your end range of motion, you can use your other foot to gently assist. You can also scoot your buttocks forward for a deeper bend. Hold for 5 to 10 seconds at maximum flexion, then slide your foot forward to straighten. Don't let your hips slide forward off the chair to fake more knee bending. Your torso should stay upright and stationary. Keep your foot tracking straight rather than angling outward. Avoid using explosive, jerky motions to force the bend. Lie on your back near a wall and place your foot on the wall. If getting down on the floor doesn't feel safe or comfortable yet, you can do these in bed instead, with your foot sliding against a wall or headboard. Let gravity slowly slide your foot down the wall in a straight path. If your foot stops sliding before you reach the point of some discomfort, you can use your other foot to help you if needed. Hold for about 10 seconds, then slide your foot back up the wall. Don't deviate left or right with your foot as you slide down. Avoid rotating your hip to the left or right as well. Try to keep your foot path straight up and down, and keep your knee lined up with your foot. Start with the seat raised high, so that your knee does not have to bend excessively right from the start. Keep the resistance setting minimal, and rock the pedals back and forth as far as you can without much discomfort. Early on, you may not be able to make full rotations with the pedals, and that's okay. As flexion improves, you will eventually be able to make a full rotation. As your motion improves even further, you can lower the seat gradually to create even more knee flexion with each pedal stroke. Don't set the seat too low initially. This can force too much knee flexion early, which can overinflame the knee. Lower the seat height gradually as your flexion improves. Start with minimal resistance and focus on smooth motion, not power or speed. If you'd like more information on why each exercise matters and general guidelines on how much to do, the original knee replacement exercise video is right here. If you're focused on improving your knee replacement motion right now, I've put another video up here that may also help. If you found this useful, click the like button and subscribe for more knee replacement education. Stay well, and I'll see you in the next video.